Carly, you're the one here right now, so I'm going to say hello. And I'm going to get started. I'm going to talk today about the FoodMarble for testing for SIBO, IMO, which is intestinal methanogen overgrowth, and food intolerance testing. So I'm going to actually share my screen so you guys can see. Okay. All right, so just to begin, I'm going to go over what the FoodMarble is and kind of go over SIBO and IMO review, just in case some people don't really know what it is. And then different testing with the FoodMarble for SIBO and IMO during treatment, and then testing for food intolerance with FoodMarble, and then using it also to help expand diet, which is a big thing when people have SIBO or IBS even, and then narrow down their diet so much. This can be actually useful for actually finding foods that actually are not causing more aggravation or may not be the cause. There may not be some of these overgrowths that are actually the cause. So people find safe foods with this as well. And just to make sure, can you let me know if you are able to see my screen okay?
Yes, I can see it.
Okay, thank you.
Thank you.
Okay. Yeah, thank you. I appreciate it. Yeah. And so as far as the FoodMarble, it's a small product, a small device that was created by Angus and Claire Short, a brother and sister team out of Ireland. I believe he started wanting to create something because his wife was suffering with IBS, and he's an engineer. So he used his engineer brain and actually created this tool so that she could actually find foods that were suitable for her without causing the excess gas and aggravation. And so they also made it, adjusted it over time to make it testing easier to try to test for SIBO. And then obviously, like I said, the foods that cause symptoms. What's nice about this, instead of just a regular SIBO test, one, it can be used at the moment when you're actually eating food. It can also be used repeatedly, so you only have to purchase one thing instead of a test over and over again. It's chargeable, and the one thing you do need is a smartphone so that you can actually have an app that attaches to that FoodMarble product, and so it can relay the information to your app and give you the actual data from that. The original the FoodMarble Air was measuring only hydrogen. The Air 2 measures hydrogen and methane. And so kind of going over symptoms of SIBO and IMO, basically when we have SIBO overgrowth or intestinal methanogen overgrowth, undigested foods and fibers feed the gut microbiome. So when there's overgrowth, it tends to be overfed at that point or have excess production. And it begins to cause symptoms like gas, bloating, diarrhea, or constipation for some people, especially if methane is present. And it also can cause lack of absorption of nutrients because they're actually digesting their foods. If we're not digesting it well and we're feeding them, they end up digesting it, or those molecules get sent through the system, and I'll go over that a little bit more, without being properly digested so that we can actually absorb those nutrients. In addition, if we have diarrhea, it's just going to be flushing a lot of times. So that's malabsorption just from diarrhea. And in general, when we look at small versus large intestine actually has an extensive amount of bacteria as per weight or volume. There's about 4 pounds of bacteria in the large intestine, which is why some of us feel so good when we actually do a cleanse for bowel prep for a colonoscopy, because you feel so much lighter, which is actually true. But that's not the same as the small intestine. Small intestine still has a lot of bacteria in it. It's just a different variety. And what happens with SIBO is that when whatever underlying risk factors occur, that can lead to SIBO, that bacteria from the large intestine moves upward into the small intestine and starts to populate in that area and overgrows. It doesn't belong there. They tend to eat a lot of different things. So they're much better at wreaking havoc, I would say, with the foods that actually are going through the small intestine. And so as far as the test from FoodMarble versus a regular SIBO breath test, a SIBO breath test measures the gas that's emitted from these bacteria or archaea, which is the organism for methane. And it measures the gases that are produced by them, and they cross the barrier from the intestinal tract to the blood. And then from the blood, it gets released through the lungs. So it basically off gases through the lungs. And that's what we're measuring on a SIBO breath test. And that is also what we're measuring with FoodMarble. So like I explained, a lot of times when SIBO is present, you have the gas, bloating, diarrhea, or constipation, or sometimes alternation for some people. Abdominal pain is often present with that, with the gas and the distension. A lot of those are similar symptoms to IBS. You can have IBS-D, you can have, which is diarrhea, you can have IBS-C, which is constipation type. And about 60% plus of IBS diagnoses are found to be actually be SIBO. So it's really important to pull those apart, because otherwise IBS people just say, well, just do a low FODMAP diet or avoid certain foods. Well, people start to become scared of foods. And so the goal is actually to find out what the underlying cause and actually help fix that. And this actually, the FoodMarble actually can be helpful with actually finding foods that actually are or are not causing aggravation for someone, because it's really difficult to figure out when people have a reaction to foods, because foods are digested at different rates for each person. And a lot of times, like I said, people start to develop food intolerances, or what they think are food intolerances. And then once treated, then those often resolve over time. Once like gut lining is restored and enzyme function is restored, those are often resolved after that. So using the FoodMarble, you can use it for testing. You can use it to find those food intolerances after you're done with treatment, to see if there's still an aggravation that occurs even after we've treated SIBO or other overgrowths, gut lining and everything back and restored, and a lot of other things are working, but sometimes we're still having symptoms. Basically, when you eat a certain food, you can actually do a test right after that and see, like, are the levels of gas rising? If there's no levels of gas rising, it may not be because of SIBO being present anymore. It might just be an actual intolerance to that food. So then from there, we're looking at, well, are we lacking enzymes still for that food, which is often the case. And sometimes just taking an enzyme or minimizing the amount of that food that we have, or the frequency of that food, can be helpful. So testing to find out, is it SIBO? And do we need another treatment? Or is it actually just needing enzymes and just less frequency and amount of that food? It keeps us from having to do over treatment, so which is really beneficial. Let's see. So when we do measurements using either a regular SIBO test, like a retest during treatment, like after we've done a round of treatment, sometimes we'll retest. When we use FoodMarble, you can actually do it during treatment to gauge progress. It's really helpful for people to see that, to know that they're actually making progress, because a lot of times when we're actually treating SIBO, people don't always feel better right away. Sometimes you actually feel worse for a while. And what they found when they've actually done studies, and they've done studies with the FoodMarble as well, they show that levels of gases will actually increase at first when we first start doing treatment, which so those die-off symptoms and things like that occur for people. That's partly why, is because those levels actually increase temporarily. So people need to know when they're using FoodMarble to track their progress during treatment. If they see levels go up, don't be discouraged, because they will tend to go down over time, which is the same thing we see with people during treatment clinically. Is when we actually treat people, you will see an increase in symptoms sometimes, and we use supports for that to help reduce that. And after a while, when those levels actually start to go down, when the levels of bacteria or archaea go down, then those gases go down and symptoms actually start to resolve, but not usually until we're getting closer to the end of the treatment amount needed. So I always want to make sure people understand that, because I don't think that's something that's shared very much. And especially if somebody's using FoodMarble and they get discouraged, then they stop treatment or they start something else, or they think that it's just not working. Knowing that is actually going to help you understand, stay consistent with it, and go to resolution of that treatment so that we know, did it really work for the full treatment? Because it's going to happen. That's going to rise up with any treatment that we do at first. And knowing, like, over time, this is just a little bit of more information, diet, medications, and age all can influence our microbiome. Diet is a significant factor as far as we can actually have our microbiome change within hours of actually eating a different food. So if somebody eats a diet that's, high veggie, high fiber, versus high sugar, high fat, or highly processed foods, your microbiome, they've shown that people's microbiome changes within a short amount of time after having done that, because those high fiber, high veggie, antioxidant foods influence a better overall diversity of healthy microbiome. And then the higher sugar, higher processed food intake diets alter it to a less commensal, which is good bacteria diversity versus overgrowth of opportunistic bacteria or candida and fungal overgrowth. And this is just noting also, like, measurements of gas levels with methane will directly typically correlate with the severity of symptoms. But the excess levels of hydrogen don't always necessarily correlate. And people will have excessive gas buildup with either IBS or SIBO. And so with the excess gas buildup, though, people start to realize they're super aware of intestinal distension and pain and hypersensitivity, which means high reactivity to that sensation, starts to develop for people that have been in chronic pain with IBS or SIBO. And that's similar with a lot of other chronic pain conditions. But visceral hypersensitivity just means hypersensitivity of the gut from distension that occurs when we have excess gas buildup. And so when we're actually testing with the FoodMarble, the gas levels, you can actually see the gas levels increase. So if we're starting at the beginning of the day, and a lot of people with SIBO note that they actually have less gas in the morning, and it progresses over through the day, and it gets worse and worse, like your bloating or your distension gets worse, or your symptoms get worse towards the end of the day. And part of that is because, one, the food intake actually feeds the organisms, so gas is produced and symptoms start to develop. But compounded from breakfast, lunch, dinner, or snacks, we're going to have increased amounts if we're not able to release that or get it to move through. And we don't always know what foods we're actually associating with. So sometimes we can have had something at breakfast that actually really started feeding those organisms, but we don't necessarily feel the impact as significantly until later. Sometimes people will think that it's their dinner that's actually causing these excessive aggravations, because by then they actually really start feeling that distension and those symptoms, and it's not necessarily happening just from those foods. They've shown with the FoodMarble during their studies that the gas levels will start to increase before they actually notice symptoms. So we can actually pinpoint either certain parts of their diet or certain foods that are actually the actual aggravator, which is really helpful. Sometimes people start pulling out way too many foods, and they're finding that it's not necessarily all those foods that are the culprit. Sometimes it's like just a couple other ones that are. And with the app that's on the smartphone that links to this, you can allow it to, it allows you to add your medications. It allows you to set up reminders for when you should be taking them, or like when we're doing treatment, whether it's medication or supplements. It helps you set up reminders for that, which is really helpful for some people, for all of us often. You're allowed to track foods on it. And then you can actually create specific diet plans. So if you eat the same kind of meal, or you create certain meals that you eat repeatedly throughout the week, you can actually create a recipe for that in the FoodMarble app, so that you can actually just say, hey, this is what I ate today, this whole piece. And there's an update that actually has actually added some brand name foods that are just like from the shelf kind of thing, where you can add those in as well. That's a new one for the new update. So if people have this app already and you don't see that, there's actually a way to update it, that you can actually get those brand name items as well. If that's something you tend to eat, is off the shelf kind of things. You can track your symptoms, you can track your gas levels, and then stool changes, which is super important, because when you come back into the visit with a doctor and you want to be able to explain what's been going on for you, or your doctor wants to know, it's hard often for people to go back and go, really, what happened with my stool patterns? It's, this has been the last month, or it's been, 3 weeks ago. I don't really remember, I kind of think this is what happened, but it's really hard to remember unless you're writing everything down all the time. So if you put it in the app, that actually is really helpful, because it actually has it stored there, and then you can just open up and say, this is what my diet was, this is what happens with my levels, and this is what happened with my stool pattern during those days. It's all in one place, and you're not having to bring a little diary. Some of us like handwriting still, but this is really helpful. And I already kind of went over, like, looking at the progress over time. It's really important to know that you looking at the progress over time of your treatment is important, versus in the beginning, your levels are going to go up, most likely. And towards the end of that treatment, or the rounds of treatment that are needed, those levels will go down. I do always like to clarify when I have an initial test, if the levels are super high, either for hydrogen or methane, you won't always notice that change in symptoms until the end of, if you need 3 or 4 rounds of treatment because of the excess level, then I always want to let people know that it's going to take that amount of time before we actually start seeing a difference in symptoms. So that's really important as well. It helps to see a difference in the gas levels for people, so that they can see that they're actually making progress, because treatment is extensive. So I really like the idea that this is available as an extra tool without having to pay multiple hundreds of dollars for every SIBO retest. So, and then just to review, like, FODMAPs, which is part of what this is actually assessing, is our reactivity to them. FODMAPs are obviously known for, like, helping with IBS, which is also helpful with SIBO. And the FODMAPs are, like, usually shorter chain, poorly absorbed sugars from foods. And I just have listed the types. So FODMAP means fermentable, oligo, di, and monosaccharides, and polyols. Some of the examples of some of those are, like, lactose from dairy, fructose from fruit, or some processed foods that often have it added, like high fructose corn syrup, which has many different names now. Sorbitol, which is often added to sugar-free foods. So it's an artificial sweetener. Inulin is also added as a sweetener in some foods, but it's also incorporated into, it's part of wheat and garlic, onions, a lot of vegetables. And then FOS and GOS are often seen on a lot of the probiotic, prebiotic blend supplements, but they're in a lot of different foods. And the FOS are fructans, and the GOS is often also found in beans. Those are also found in some of the wheat, garlic, onion kind of pieces too. So they cross over a little bit, but when people do testing later, and we'll go over that a little bit, when you see different test options for fructose intolerance, lactose intolerance, that's part of the reason why some people might just have only a lactose intolerance or only a sorbitol intolerance. And it's important to know that, so we know what foods are ones we should, like, reduce or avoid versus, like, everything. And for those of us who've been there, reducing everything really is not fun. So there some reports are showing that about 85% of IBS sufferers have high FODMAPs as triggers for their symptoms, which is part of the reason why Monash University developed low FODMAPs and found that it was beneficial for people with IBS. And then we found that, it also is beneficial for SIBO, because so much of IBS is actually SIBO. And why that is like, when we have overgrowth, those sugars aren't digested well by us at that point, which means that the bacteria that's overgrown can feed on it highly. And from that, they release a lot more gas, because when they actually feed, they create more gas. And when those actually increase, it increases bloating and distension, of course, which equals pain. Added to that, when those molecules or those sugars are not digested down fully, when it gets towards the distal end of the far end of the small intestine or the large intestine, those molecules are still a little larger and they attract water, and it causes more of the diarrhea impact. So sometimes people will go through phases of diarrhea, normal stools or constipation and diarrhea, and other people will just have diarrhea consistently. And that's part of the reason why, is because when we have these larger molecules, they just hold water in to the large intestine, and it is called osmotic diarrhea, or what just flushes it. So, and then this is just a review of the different gases. And so with that, the hydrogen is the one that we kind of knew about first. And then that often causes diarrhea, bloating, gas, and pain. Hydrogen sulfide is a little more recent finding of being able to test for. We didn't have a way to test for it well. And now we have a different test that we can use for that. It's called Trio Smart. But that often causes either diarrhea or constipation. A lot of people have said that they thought it was causing diarrhea. But clinically, with my peer groups, we're finding also constipation is pretty consistently there. Bloating, gas, and pain. Methane, which is a CH4, is the other gas that's created by a different organism. It's not a bacteria, it's called archaea, and it directly paralyzes the nervous system of the gut. So when that happens, constipation happens, because the nervous system is what helps peristalsis, which is like that bolus of food moving through and getting stool moving out. It also is the migrating motor complex, which is that sweeping wave that helps keep things brushed down, basically from mouth all the way down to the rectum, keeps bacteria and debris brushed down, and small intestine bacteria moving towards large intestine, and not the reverse. We don't want large intestine bacteria moving up. So when those movements get disrupted, that's when this overgrowth occurs. So methane is one of the few that actually we know when there's any increase in methane, it directly paralyzes that nervous system, whereas the others aren't the same impact necessarily. Which is why methane causes constipation. And FoodMarble right now does not test for hydrogen sulfide. They are working on a model that might do that, but as far as I know, we don't have one yet. And hopefully we'll be finding out soon, but that would be really helpful to have some other testing option to see that. So when people buy a FoodMarble, the different options for how to do testing are really helpful. So sometimes people can just do daily testing to determine their gas levels after each meal. Like I said, sometimes pinpointing what food or foods are causing aggravation can be really helpful, because a lot of times we don't actually have the symptoms build up until later in the day. So it's hard to pinpoint, was it from 8 hours ago, or was it actually just now from this food I just ate? And the testing can actually help us determine that. You can also do it just being very scientific about it by just eating a food. So like I said, instead of just a full meal where you have to kind of parse out, like, what is it that I'm aggravated by from that meal? You can actually, if you get down to like, I think it's might be garlic or onions or whatever that food is, you can actually literally just do a little bit of fasting prior to that, eat that food, and then shortly after, do a test, do a breath sample on the FoodMarble, and that can help. And then the kit itself, when you buy a FoodMarble, you can actually also include a kit that comes with it with substrates, which is some of the sugars, to test specifically for fructose intolerance, lactose intolerance, sorbitol intolerance, or inulin. A SIBO test, typically we want it to be done with a lactulose test. And so lactulose is not something we look for intolerance to, because we actually don't, as humans, we don't absorb or digest lactulose. Only the bacteria do. So those other four pieces actually are added to this test kit. So you can actually do it similarly to a regular SIBO test, where you have a food prep for the, the day or two prior. That's really non-feeding. It's low FODMAP. It's, like the chicken, white rice, eggs kind of diet for the 1 or 2 days prior. And then do the overnight fast. And then you can actually do those samples. You do your baseline breath, and then you do your samples with that substrate drank after that, and to see, like, are you actually having reactions to that substrate? And do you have an intolerance to that one? And the FoodMarble will give you, when it syncs to your app, it actually gives you levels of severity from 0 to 10. So the bottom third of that is saying, like, you're not severe, you don't have, major symptoms or levels. Excuse me. The middle third is saying you're in a moderate area. The higher third is saying you have more severity with your levels. They did that so it makes it just a little bit cleaner and easier for people to use, especially if people aren't familiar with the parts per million gauging that we use as clinicians. And so there is a way, though, for your doctor to actually gain access to what the equivalent is from those 0 to 10 markers that come up on your app with your FoodMarble. If your clinician has an account that syncs with your app, that says your app will sync to the cloud, it'll actually send over the information to your clinician saying, here's what the parts per million were for their testing that they did. So that is a way also for us to get access and to know the actual parts per million from your testing. And I kind of already went through this a little bit, like the longer term view to help provide recall of symptoms, gas levels, and change to picture as the treatment progressed. So that's really helpful to keep in the app. It's helpful for both the clinician to see and also for the patient to see sometimes, because we've already been in such pain and aggravation, and sometimes a fear base from like food. It's hard to actually see the improvement as it's going. So you can actually see it and written down. Sometimes it's actually easier to like see that progress at least being started or being made. And also noting, like I said, sometimes when we are doing some of those individual food tests, or to eat or to do those other fructose intolerance tests and sorbitol intolerance and things like that, we will find that not all of our symptoms are related to excess gas levels being produced or to FODMAPs. So then we're looking at other functional issues or other reasons for intolerance at that point. And also recognizing, like, are we actually chewing our food? Are we digesting our food? All those pieces of digestion matter. Are we anxious when we're eating our food? There's a lot of other pieces that go into that as well. And so when we're thinking about when to do a test with the FoodMarble, the timing, it's hard to tell people when they should actually test. So if we're testing after a meal or after a specific food, how long after should we test? Should we wait 10 minutes? Should we wait 30 minutes? Should we wait 2 hours? Each person is independent. Like, that's part of the reason why they also created this, is because they realize everybody's an individual. Everybody's digestion works differently. We all digest things at a different way, at a different rate, and a different capability. And that changes based on what's happening with us. If we're changing medications and supplements or diet or activity levels, if we age, all those things make a difference. So every person is different. So what they suggest a lot of times is when you first start testing and you're starting to get used to how to test and how frequently and to gauge what you're finding, is to just try, like, after a meal, like, test it for an hour after, test it at 2 hours after, test it at 3 hours after, to see, because some people actually do take a long time to actually digest if they have delayed transit. And then you'll actually be able to see when is your level the highest after that one meal or that one food. And then you might have a better understanding of when your normal test time should be. So I hope that makes sense. And please later, like if you have questions, write them down, let me know at the end. If we have time, I'll just kind of go through some questions. And then the thing I really think is important with SIBO, with IBS, with any of these conditions is finding a way to help people expand their diet, because I have people that I have seen that are literally on 2 to 5 foods. Obviously out of like reactivity of their digestive tract and food fear and fear of pain, and just, digestive aggravation. That's not healthy. It's not healthy long-term. It's not healthy short-term for some people. And so this can actually help people expand diet. One, if it's in that severe of a category, immediately could help them figure out like foods that are not actually the culprits for their symptoms or their levels. But also as they're going through treatment and things are actually getting treated and the levels of bacteria are going down, people will start to find foods that no longer are actually creating higher gas levels. And so then they can actually realize, oh, I can actually start eating some of this food now, which is amazing. It's great when people actually can start to expand their diet. And then also recognizing, same thing as we kind of discussed before, the amount of a food or the frequency of your food can matter. So anybody that's done low FODMAPs or SIBO specific food guide from Dr. Seebecker, anybody that's done anything diets understands that as well, but this can actually help us gauge that a little bit better. Let me make sure. Yes. And I went over this a little bit, like the food intolerance test kit for the 4 common FODMAPs is the lactose, the fructose, the sorbitol, and the inulin. So in a fasted state before you start the test, and you do the 3-hour test after your initial baseline sample. So doing the baseline sample before you take the substrate. So fasting overnight, first breath without the sample, take the sample, and then for every 15 or 20 minutes, do a sample up through 3 hours to see whether you're actually having an increase in those levels. So it can show whether you actually have an intolerance to maybe just one of those. I mean, the amount for intolerance rates are different than what people have often thought when they've actually looked at the studies and collected some of the data on this. They found that sorbitol is actually the highest intolerance rate. And then next to that is inulin, and then fructose, and then lactose, which a lot of people would have thought, I would have thought that lactose would have been higher up there on that intolerance level. So if you can find like only 1 or 2 are aggravators, then you look at what foods are incorporated into those categories, you can actually expand your diet quite a bit by adding other things from the other categories you're not having a reactivity to, which is significant for a lot of people. On the app, they have a dietary area that is color coded for ones that are safer, so there's like, I believe it's green, yellow, red, or green, yellow, orange, red, for ones that are safe, green, and then red may be ones that are higher FODMAP and higher fermentables. And then you can also, on the app, you can search for specific food types. So like if you knew that you had a lactose intolerance, you could search for the other foods to see what ones will come up, and you can create a meal plan using that. And you can also find out like, well, does this have lactose? I don't know if this has lactose. You can actually look up that food and see like if it does have lactose, and that might be part of the reason why you're reacting to it, or if it has sorbitol, or whichever your reactivity is for that kit, if you use the kit. And then, like I said, you can create meal logs of what you've eaten, and same thing, it correlates with like what your levels were during those times. And they said they have a new update too for their app that also does a point system. And I haven't updated, so I don't know the actual point system. But from what it sounds like, it's just a point system of like, this is how many points per day you can have of these different higher FODMAP foods or portions of higher FODMAP foods before you probably would start to experience symptoms. And so to me, it's like Weight Watchers, like a point system of like how much you can probably eat without causing more aggravation. And remember, the diets do not treat SIBO. They just help manage symptoms. So none of our previous trials of trying to utilize diet have ever gotten rid of SIBO fully. It just helps really manage symptoms. And on the app, there are recipes that are available. There's access to blog articles that they have connected that give more information about either using the FoodMarble or communities that are created. So there's actually also a Facebook group, which I think is on one of the last pages. I'll go over that in a second. But there's actually a Facebook group for people that use it. So, kind of sharing stories or asking questions of each other. And the blog articles are, about SIBO and how to use the FoodMarble and things like that. And I kind of already went through this a little bit. Same thing, individualized information instead of me generally giving you like, hey, just try this or try that, which is, sometimes as clinicians is the best we can do in the time we have. But having more individualized feedback and quick feedback is so useful. Useful for me, but so useful for you as a patient. And like I said, symptoms are not always reliable because the digestion takes different rates. Different foods digest at different rates as well sometimes. So figuring out what is the cause of your symptoms can be really difficult to do. So this is going over how to use the FoodMarble specifically. And if you're just doing a single breath test, you basically turn the app on, you turn the device on, and the app leads you through all of the steps, like very directly. On your app, when you open it up, you're going to hit the plus button, which means like a new reading. And then you're going to click on a button that says breath or breathe, I guess. And it'll tell you when it's ready. And then you hold down the top of the button, and I apologize, I don't have mine with me. You hold down the button on the top of your FoodMarble. So it's like a little device like this big. And there's a button on top. So you hold it down for 3 seconds and it'll actually tell you when it's ready. Your app will tell you when it's ready. And then you basically are taking a short breath in. They call it a pause breath. And then you put the FoodMarble up to your mouth and exhale into it for 5 seconds and the goal is what the advice is for that. And just similar to our other SIBO test, it's like you're blowing on soup, cooling soup, just a slight breath going all the way out. You don't have to do it really heavy. And then it'll let you know when it's done. And it'll tell you if you did a great job. It'll say you did perfect. And then it shows you the score. So high, medium, low, it gives you the score of it from 0 to 10. And like I said, if you're wanting to test for after meals, you can test each hour after a meal. So at 1 hour after, at 2 hours after, at 3 hours after. Usually that's plenty of time for us to gauge like how fast is the speed of your digestion and how best to use the unit for your rate of digestion. And then if we're wanting to do this for an actual SIBO test, you use the same instructions, but in a fasted state with a prep diet prior, and then a sample breath for the baseline again. And then when you actually are on the app, there's actually a choice for a SIBO lactulose test, which is called challenge. So you have the prep diet for 1 or 2 days prior, depending on whether you have constipation predominance or not. You do the 12-hour fast overnight. You do your baseline breath sample without any substrate. And then you want to make sure that you have lactulose substrate to do your test. And then you're going to actually open the app, hit challenge, and follow those same instructions for doing the breath samples. The 3-hour test, typically, that's what I encourage. That's most of us here encourage. So every 20 minutes, until it's done. And then that 3 hours gives us the full intestinal tract, which is really important. A lot of other people don't assess the full 3 hours, but if somebody's in transit, I like to see somebody's transit from mouth down to the rectum, because if somebody has methane overgrowth, that is going to be closer, possibly all the way down to the large intestine. And if we stop at 90 minutes or 120 minutes, we may not actually gauge that and not see that they actually have methane overgrowth. It may not show up right away. So sometimes we need that to actually get that whole gauge. Hydrogen is only measured from the first 90 minutes, depending on somebody's transit time. But 90 minutes is the gauge from the data collected and evaluated by the North American Consensus, which is a team of researchers and doctors that pulled together like how to define the definition of SIBO. So a full 3 hour test is usually best. And you will need a prescription for the lactulose, because here in the US, you have to have a prescription from a doctor for that. And that can come from any pharmacy. And with the FoodMarble, you can actually separate scores out. So if you have the Air 2, you can actually separate out hydrogen versus methane levels. On the Air, you're only going to get hydrogen levels, like the Air 1. And the scale is going to be 0 to 10. And like I said, if you work with a clinician that gets access to that, they can actually see the parts per million. So we can actually see what that test would be like. In the beginning portion, if you don't have access to a clinician that has access, you could, and you're aware of what parts per million means for you, you can actually do a rough calculation, and what they call it is the F score, which is a fermentable score or fermentation score. Anywhere up to a score of 8, you can multiply it by 5, and that gives you a rough estimation of parts per million. Above 8 on your score given, it won't work anymore, because that is more of an exponential increase. There's a logarithm that's actually needed, a different calculation, and that has to be done actually by a computer. So, and then, like I said, there's that Facebook group that comes with this. When you buy a FoodMarble, you get access to their Facebook group. It's called Air Insiders. And that is where you have the community that you can actually have support with and reach out to for use of the FoodMarble, or like discussion about SIBO and your experiences, or, you know, concerns you have or questions. So it's really good community to actually help support you in understanding how to use it, and, you know, to have community for like what you're going through. And as far as like, I think that's on the next thing. So my personal opinion, I haven't had enough use to determine the best function for it as initial or repeat testing, like full SIBO testing. I've had quite a few patients that actually have used it for like evaluating foods that they're sensitive to, or they're having aggravations with. They've used it during treatment and have experienced that same thing, where it's like an elevation at first and they get upset at first, and until we realize, you know, that's normal and it's going to actually reduce down over time. I love the fact that you can use it to expand diet instead of narrowing diet down without understanding what is actually the cause of your symptoms. And that's a significant thing for anybody that has gone through IBS or SIBO or IMO. And the retesting piece, when we get more consistent, I am in a group with a whole bunch of other practitioners that do a lot of this. But once we can compare side by side, like a regular test and a retest with a FoodMarble, or get more data gathered, it could be a much less expensive option for testing, initial testing and retesting. So I would really like to see that. This is a significant difference in cost for people, and much more useful tool if it stays accurate, if that's accurate for that. And the other thing I will say too is, people often ask, can you use it? Can multiple people use it? And that was reviewed with Angus and Claire Short, and they said that it is okay to use with multiple people. It is not a great thing to use it multiple people, multiple times a day, because you can actually get too much moisture buildup in the equipment, and it alters the levels over time. And it obviously will wear it out quicker. It has a lot of, I don't even know what the number is actually for how often you can use it, how many cycles it can be used for, but they said it's pretty extensive. But if it's used too much in one day, and too much moisture builds up, then it can alter the ability for it to measure. So basically they say try to use it for yourself throughout whatever you're doing, testing, treatment, and whatnot, and then let somebody else use it, and then that's theirs. And there is a way to obviously clean the outside of it, and there's a mouthpiece that you can actually take out and clean as well. And so that's a great option too. So maybe be able to have that. And so in summary, there's the FoodMarble, there's the Air and the Air 2. Air 2 measures hydrogen and methane. The original one only measures hydrogen. They are working on one for hydrogen sulfide, which is great. That would be great when they actually get it. And also for testing for sulfur-based food aggravations, which is another thing a lot of people experience. And we're trying to differentiate that sometimes with people when they have aggravations with SIBO or IBS, or even with just like histamine reactions. And it's great for testing for progress with treatment to actually see levels changing for people when symptoms aren't changing necessarily as much. It's great for understanding food aggravations and for retesting. Hopefully that's going to be hopefully a reliable, great option for that. And I love, like, it's a lot easier to use. You don't have to have this whole bulky kit. It's personalized, so you can personalize what foods work for you and don't work for you. And obviously a lot lower cost. So thank you so much. I appreciate you listening. If you have questions, you can like unmute, or you can send me a message. Let me know if you have questions at all.
I'm still here, sorry.
You're fine.
I loved this presentation. I'm a colon hydrotherapist, so I was like,
Oh,
I'm be in this presentation if I'm the only one. And in Washington, we have to have a pretty integral relationship with the naturopath here, like to get referrals. So anyways, I love the presentation. I had to, my client showed up early, so I had to step away. So, but
it's okay.
But is it okay if I email you to ask you some more questions later, or can I send you a Facebook Messenger? Is that okay?
Yeah, go ahead. And so the clinic actually has an email.
Okay.
And I'm still recording right now, but you can send it to the info@cdahealingarts.com.
Okay.
And just mention Dr. Misty, and yeah, I would be happy. And then you can share your information. And where are you at in Washington?
Spokane. I actually have to go. My client showed up, so thank you so much.
You're welcome. You're welcome. You're welcome. You too. Have a good day. Thanks for listening.